And medical workers across the country are reacting to President Trump's decision to withdraw the U.S. from the World Health Organization. The move comes after Trump's attempt to remove the U.S. from the WHO in 2020 before he left office. President Biden reversed his action in January of 2021. So what does it all mean for your health? ABC News medical contributor Dr. Alok Patel joins me for more on that. So, Dr. Patel, the WHO monitors disease and outbreak around the world. It played a major role during the COVID-19 pandemic. So why do this?
The big reasons cited by the incoming administrations are that the United States pays an unfair amount of money towards the WHO historically. Since its inception in 1948, the United States has been one of the largest contributors among 194 member states. There's also accusations about political influence on the WHO and the fact that the WHO, according to the incoming administration, has not adopted urgently needed reforms. Now, to give you a sense of the spending over the last decade, Diane, the United States has spent around $160 to about $800 million annually towards the WHO. And to give you perspective, in 2020-30, we spent almost $5 trillion on United States healthcare spending, including a budget of over $1 trillion for HHS, just to give you a sense of how much money is actually being spent towards international global health coordination and domestic United States health.
So how could pulling out of the WHO affect Americans? Are we going to see any changes in our day-to-day? And what happens if there's another pandemic?
It's hard to say immediately how many changes we would see in the day-to-day because it does take about a year for this to go through if it's not overturned by Congress. But there is a reason why many international public health agencies have said that this could lead to a less safe United States. As the WHO says, a humanitarian crisis anywhere is a health crisis. The data surveillance and international coordination by the WHO is responsible for responding to any global health catastrophe, whether it's an infectious disease outbreak, it's a natural disaster, or it's a conflict. This coordination is how we're able to get such quick responses by preparing, coordinating, and responding. Why the WHO has been able to eradicate smallpox, come close to eradicating polio, respond quickly to bird flu, Mpox, Ebola, Zika, and more. It's also extremely important that we pay attention to guidelines the WHO puts out, whether it's through travel guidelines, infectious disease guidelines we use every day in the hospital, or even public policy statements surrounding tobacco. There is a reason when you add all this together that staying with the WHO creates a more healthy and productive workforce, which is why they say that $1 from the U.S. to the WHO is a $35 ROI. We have a healthier population.
Meanwhile, a new study is showing that RSV vaccines given to pregnant moms makes them less likely from getting RSV and less likely to be hospitalized with RSV. How significant is that? Walk me through these percentages and what it could mean for the future here.
This is extremely significant. RSV hospitalizes 800,000 children under the age of 5 every single year, and that's only in the child population. We're not talking about older adults or those who are vulnerable. So this study shows, and this is looking at medical records, that pregnant women who were vaccinated against RSV at weeks 32 to 36 of pregnancy, their newborn babies were over 60% less likely to be infected, but about 78% less likely to be hospitalized. So this data shows us that RSV vaccines can protect newborn babies for up to 6 months against getting RSV. And if they do, they're less likely to get severely ill. And as a reminder, there is an RSV antibody available for babies born in the first 8 months of their life, or a vaccine longer if children have underlying medical conditions. So this is potentially huge positive news against an infectious disease that plagues so many millions of people around the world every single year.
All right, and I just want to clarify because I think I said it wrong. I think I misspoke. It's protecting the babies, so it's the babies who are less likely to get the infection and less likely to be hospitalized with it. Is that right?
It is. It's protecting the babies. But you know what, Diane, as you and I both know, if babies get sick, it affects the entire family, not only through infectious disease, but think about all those times you have to stay home, you have to coordinate childcare or whatever, even if a baby has a common cold. So there is a trickle-down effect when it comes to the indirect costs of infectious disease, not just preventing hospitalizations, but keeping the entire family safe and sane.
I was drinking to that because amen. Amen to everything that you just said. Dr. Patel, thank you.
Thank you.